All right, we are live. Welcome, y'all, for those who are watching us on YouTube and those who are watching us on one of these Facebook pages here. I'm so excited. This is discussion number two, as June is referred to as Alzheimer's Awareness Month. And so we are talking about forms of dementia this month, and we have caregivers who's coming to the table to join us, as well as those in the medical professional. And I have a special guest today because we were trying to figure out, hold on, we went to school together, right? What school did we go together? Okay. So I knew her from way back when. I won't tell you what year I graduated from high school. So I definitely don't know what year it was when I was in middle school, right? Okay, glory to God. But
Right.
somewhere before 94, right? Oh my gosh, I think high school like 94, 98. Yeah. That sounds about right. Okay. So way back when, okay. And I have the honor and the privilege to sit here with her, Dr. Narria Matthews, and we are going to have a great conversation because this is unique in the fact that she's part of the medical community, but then also she had the ability to also be a caregiver to her grandmother. And so, welcome, Narria. How are you today?
I'm great, Tanis. Thank you so much for having me.
Oh my God, I'm just so excited that you are here and you can sort of help us sift through some things as well as speak from two different perspectives. So, this is going to be a really good conversation. And so, let's just sort of jump right in here. Okay. So, tell us a little bit, who is Dr. Narria Matthews?
I am from Savannah, Georgia. I have been actually in the Atlanta area for over 20 years. Went through the Chatham County Public School System, went to undergrad at South Carolina State University in Orangeburg, HBCU, and then went on to pharmacy school at Mercer University in Atlanta, and essentially have resided here in the Atlanta area for over 20 years now. Excuse me, I'm an only child. Growing up, I grew up around my mom and my granny all the time. And my grandmother, obviously, in retrospect, I recognize now that she had signs of dementia and Alzheimer's. I feel like ever since back when I was in high school. But of course, as I continued through my schooling in pharmacy school, definitely learned a whole lot more around the disease and what that looked like. Also, medications to treat Alzheimer's specifically, about supplements and also the side effects too that come along with those medications that can help decrease the progression of Alzheimer's disease. And just bigger picture, again, just understanding it from the perspective of a caregiver. Later in life, my grandmother actually lived with me for 6 years. And she passed 2 years ago. But being able to assist with caring for her from a caregiver perspective, and also watching that continued progression of Alzheimer's, and also as a healthcare professional pharmacist, dispensing those medications to patients with loved ones with Alzheimer's.
Oh my gosh, you said a mouthful there. So I want to jump right, piggyback off what you just said there. Why did you choose the route of pharmacy?
It's funny you should ask. I actually work for CVS, right? So I started 26 years ago as a cashier at the Revco on the corner of Victory and Skidaway. It used to be in that shopping center on the corner where the Starbucks is. Then, of course, they built the store across the street. But I was looking for a summer job. My mom knew the pharmacist that was there. Um, they had actually worked together at Memorial years before. And Karen Graham, she's a pharmacist with CVS back then, and she still is one. She hired me as a cashier. At that time, not even giving consideration to a career in pharmacy whatsoever. And here we are 26 years later. I don't know if that's a good thing or bad, but with the same company. But that just piqued my interest in healthcare, learning about drugs and things of that nature. Again, just never expecting 26 years later still be here. So, yeah.
Wow. All right. So let's talk a little bit. What is a pharmacist? I think a lot of people have in their minds about some of the things that you do. Okay, I know that y'all give out medications. Okay, y'all fulfill prescriptions. What else does a pharmacist do?
Yes. So in the retail space, right? So pharmacists are healthcare professionals, of course. So we go to school, have a doctorate degree in pharmacy. So that allows us to more or less be the gatekeepers, I say, of the drugs. Obviously, doctors have medical knowledge to prescribe drugs based on a patient's health condition. Those prescriptions are then sent to a pharmacy for them to fill. So when those prescriptions are presented, we review the dosing guidelines, the frequency of use, whether it lines to the medical condition that the patient has, also screening for any potential drug interactions that the patient may be on with other medications and things. We counsel them on those prescriptive therapies as well as over-the-counter drug supplements and such. We do medication therapy management. We are the liaison essentially between them and their providers, oftentimes helping to come up with alternative drugs if there's a cost concern and things of that nature. So it's a lot of things, and obviously we provide medical advice and consultation on demand. When a patient walks into a pharmacy, they have access to a pharmacist almost immediately to help address some of their concerns around drugs, around supplements, and even like basic things like OTC recommendations for different medical conditions as well.
Okay. All right. That was a mouthful. So let's talk a little bit about in regards to medications that may be prescribed to those, specifically for those who have Alzheimer's. I looked online and I noticed that there were, I guess, like some possibly two FDA approved medications, but it seemed like they are geared towards temporarily easing the symptoms or to help try to slow down the progression of Alzheimer's. Talk to us a little bit about medications and the role of it, even the efficacy of medication for those who have Alzheimer's or forms of dementia.
Sure, absolutely. So there is no cure for Alzheimer's. Sad but true. There is no cure, right? So with a diagnosis, oftentimes doctors do prescribe one of the medications that are out there to your point, slow down the progression of Alzheimer's. However, again, having the pharmacist hat and the granddaughter hat as a caregiver for someone with Alzheimer's, and thinking that through, right? So, what patient ever goes to their doctor and says, I think I have Alzheimer's? None. It's only, well, more so in the instances in which they are closely monitored or supported by a caregiver or someone that lives with them that notices these things in terms of, okay, this isn't quite right. So, those who are fortunate enough to have someone there that identifies these symptoms and knows something, it's not quite there. Oftentimes, it's those who perhaps may go to a doctor's appointment with them to then talk through these things and then be prescribed medications. So with that being said, I feel like it's a lot of people that aren't don't even know, don't have access or anything to whether it's a prescription drug or a supplement to, again, slow down that progression. So with regards to the medications, there are, again, a few that are on the market that help to slow that progression down. I recall my granny was on Aricept. So it's a great drug. Now, how you can quantify how much it slowed it down, obviously that's also challenging as well. I will say, I feel like in terms of my granny specifically, it did help. However, one of the side effects with the one that she was on and the whole class that this treatment therapy falls under, one of the main side effects is weight loss. So I recall vividly one of the big telltales with my granny was that she loved to cook. She would start cooking something one day, and by the end of the day, that meal was not done. So it seemed like nothing at first, but then of course, as it continued on, it's like, okay, but so she started the medication, right? And so we would make it through a pot of greens. So, old school, they want to use smoked meat, onions, cook it. Okay. So before we would get granny cooking the smoked meat, we never saw the greens in the pot, right? So then she started taking the medication for about a month or two. Then we kind of saw a little pickup and improvement around just things like that, being able to follow through processes around cooking or anything else. Then we also noticed she wasn't eating. So it's like, okay, where do we go with this, right? She was a healthier woman, so she could stand to use a few pounds, but then applying that to someone else who perhaps is already perhaps on the thinner side, what's the trade-off here? Is it worth it? And then with the symptoms around Alzheimer's, they are so unique and different in most people. Some of them, there's a common thread with some of the behaviors and such, but still, again, if I was someone having to choose between them losing more weight versus possibly improving their day to day memory capacity, that could be a tough decision for lots of people. I'm grateful that over the years, though, we've gotten far more knowledge around like some of the things that give you a predisposition to Alzheimer's. And then supplements also that can help, but even still, by and large, that space around those drug therapies come with side effects.
Yeah. Um, so in regards to Alzheimer's, do typically individuals with that diagnosis also deal with hallucinations, or is it other forms of dementia?
There are other forms. I feel like that is a common side of a common symptom that is oftentimes associated with it. I feel like forgetfulness and sundowners are more common that I've seen in my experience with dispensing those drugs and talking to caregivers, as well as, again, my own personal perspective. The hallucinations, that could potentially be a side effect of one of the primary or adjunct drugs that they use to treat patients with Alzheimer's. And then that's something I really didn't touch on. Yes, again, they have like the primary drug class that is to slow down the progression. However, with those side effects, oftentimes you end up then prescribing other drugs to counteract some of the side effects. So yeah.
I'm glad you went there because, I was about to move into that next question there as well, because sometimes you see a little hesitancy from family members because of like, well, I'm seeing this type of issue here. And then they look at the side effects and it's like, well, I don't know. There's a whole list of side effects.
Mm-hmm.
Um, what would you say to parents or loved ones who are trying to make a decision in regards to something where I came for this, but I'm really concerned about the whole list of side effects?
It's very hard to embrace, and I found that more so to be more challenging in dynamics in which, say, perhaps their loved one is well enough to live independently, but not sick enough for them to feel the need to move them into their home or to be in that space with them all the time. And a huge call out is that when you only see them intermittently or like maybe for an hour a day, all of this is largely a huge miss. I feel like it's more so when you spend time around them for like lengthier periods of time and like consecutive days, that those things become like, okay, hold on, yeah, this isn't, they aren't all together. So when families are able to identify these things, it's amazing because, for those who see them less frequent, they're like, no, what are you talking about? She seemed fine to me. I called her today and, we carried on the conversation. But again, it's when you drill down and just have more time to really observe, then it's easier to identify. So in making that decision around, essentially risk versus benefits, and that's something that, as pharmacists, we too, provide advice on. We don't, obviously sway anyone one way or another. So they have to be able to assess risk versus benefits with regards to those medications. Again, it's not a cure. It could perhaps slow it down. How much is it going to slow it down? How much is it going to improve their quality of life? Those are questions that we don't have quantitative data to substantiate. So it's very individualized. More so now I feel like people are doing more holistic treatments as opposed to prescription drug therapies. In terms of, is one more efficacious? Hard to say, so it's rather individualized in that regard.
Oh, thank you for that. So let's talk about those who possibly have increased genetic predisposition to a form of dementia. Um,
Mhm.
there's so many supplements out there, all right, that talk about boosting your memory. Okay.
Mhm.
Can we talk about that? Is it better to take supplements to try to boost your memory, or is it I don't know if this is the right way to say this, but is it better really just to do our best with trying to sleep better and eat healthier and to exercise? How do people decide, or is just a combination of both a good thing?
It can be a combination of both, right? However, just not only with Alzheimer's, my view is this. If you have a genetic predisposition to Alzheimer's, hypertension, high cholesterol, any of those disease states, right, it makes it that much harder for you to manage that condition if you end up with it. Can't pick your parents. So, that's essentially like in you, so to speak. Um, Also, too, for me being a little girl, I now know that my great grandfather had Alzheimer's, my grandmother's father. So, knowing what I know now, knowing that she already had that direct, again, genetic predisposition, caring for her, seeing her progression, and now my mom, pressing 70, has that genetic predisposition. Knowing what I know now, I would definitely, if we could have been ahead of this years ago in hindsight, like the sleep. I recently did see a study around that associating the number of hours you sleep with increased risk of Alzheimer's. Mom, watch this, please. Yeah. Um, and then eating, processed meats and things of that nature also contribute and increase your likelihood of that. So if the genetic predisposition is already there and then you already have these habits that are not conducive to preventing it, if we again could just go back and just be mindful and cognizant more, so I feel like that's far far more impactful than these supplements. That doggone what's that stuff, there's a drug that every Prevagen. That's, I feel like, is the number one supplement that they have, for boosting your memory. That stuff is like $60 a bottle, and I mean, if I was older and I actually tried to do self introspect and felt like I had memory issues, not perhaps wanting to own up I may have Alzheimer's, but they'd probably be scrambling for everything they could to hold on to that, you know. And does it help? Possibly. But do we really know? No.
That's what I was wondering. I mean, it's just so much out there. It's like
Mm-hmm.
how do you weed through what's good and what's not, and people who just trying to get money out of people, you know?
Yeah, yeah. I mean, it's. I feel like, well, coupled with the, trying to be proactive and taking care of your health, but still just being honest with yourself. If they are at that mental space of being able to accept that perhaps this could be me, or even in caregivers accepting that it could be their loved one. Just imploring tools also, like whether it's lists or whatever reminders in their phones and things like that too, could help.
I like that. Let's go there. Let's talk a little bit. I want to move into like strategies, that tools and resources that you could offer to loved ones who may be in beginning stages or may actually be sitting here saying, "I'm wondering if this is my loved one." Can you talk to us a little bit about your grandmother, like some of the beginning stages, the beginning signs and symptoms that you begin to see, and then just sort of help us understand like the progression of it?
Absolutely. Um, like I said, I think I recall being in high school. My grandmother's always loved to shop. She started buying repeats. Like literally, she would have the same shirt hanging in her closet, like two, and she would swear, like, I didn't buy that. I don't remember that. Or brush it off. Actually, if she kind of maybe did remember, like, dang, I really did buy this. And this wouldn't happen like repetitively. It was like over the course of time. So then we look at, okay, you done bought the same. It wouldn't be like literally the same shirt 3 times, but then you now have 2 sets of the same shirt, you know. And then it was just like building upon that, and then coupled with the cooking. But one very pivotal thing happened, right? So Granny lived independently. She was driving up until I feel like she was 80, probably 80, I feel like. So to get in her car and go to the grocery store, nothing. Pay her bills, no biggie. I got to a point to where her lights had gotten cut off in her house, I believe. My mom stopped by and was like, Mom, what is going on? There's not a power outage. Why are your lights off? And she was just, my granny was frustrated. She was fussing. I don't know why my lights off. I paid my bill. So back in the day, of course, like they didn't do any electronic payments. Granny used to get the bill in the mail. She would write her checks out, balance her checkbook, Put the check in the envelope, put the stamp on the envelope, put it in the mail. Boom, Georgia Power gets their money. So my mom and my granny are involved in this discussion, like trying to drill down why the lights are off. My mom calls Georgia Power. They're like, man, we hadn't gotten a payment in 3 months. We sent her the disconnect notice in the mail. And so granny is like, no, I paid my bill. Da, 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 da. So the end of it was my mom goes in granny's pocketbook. In granny's purse is all these bills that she wrote these checks for. So she had the wherewithal to know that it was a bill, know she needed to pay it, got the check written, got it written out. It made it to the purse and never made it anyplace else.
Mm-hmm.
That was the truly pivotal moment. Like, hold on, this we yeah. Mm-hmm. So from there, my mom shifted to my mom's a clinical social worker, so she recognized, okay, no, she made a doctor's appointment. Started going with my granny to her doctor's appointments. Partnering with the doctor to do they have assessments. I forgot what it's called, but formal assessments to try to quantify as best as they can, like the extent of the Alzheimer's, and then gave recommended prescriptive therapy for granny. So trying to get granny to understand that it was very hard and very challenging. My mom became like medical power of attorney and all those things, like on the legal side, to try to protect granny as much as she could, and trying to even help her maintain some independence, but still knowing that she needed to be there in the background to support, because we don't need granny with the lights off again. So that was very, very challenging. As the disease progressed with her, at times she became combative, argumentative, very obstinate, and very confident that she could take care of herself. When we had so many signs along the way that, no, we need to help you with this. Fortunately, granny was not a wanderer. I've heard so many horror stories about people with loved ones who walk out the door and would go places and get lost and things like that. Thank God granny was not, because as her disease progressed, she was still driving. And we were just at almost a crossroad of, how do we take these keys from her? So thank God that worked out the way it needed to. And yeah.
So now, as far as her level of independence and her home environment, now, did y'all stay with her? Did she move in with you all? Did you have like nurses and support staff that came into the home to assist her? Did she go to like a daycare type of setting, or some outings throughout the day? What did she do as the thing progressed?
As it progressed, so God has a way of working things out just the way they need to be. Granny lived independently until my uncle, her son, passed. At that, and he was living in the home with her, but being a male child, still not the same, trying to care for your mama. So recognizing that my mom, after he passed, she moved into the home with granny. And that was the best thing ever. My mom at the time was still working, so she hired caregivers to be there with granny, but we had to be even strategic with that, right? So we initially hired just an independent company to come there. Oh my gosh, granny doggone fuss and cuss. Who is this in my house? Why are they here? I am fine. So we pivoted from that and like, okay, this isn't gonna work. So we ended up getting a cousin who was like a CNA or something to stop by to come check on granny. And she was so great with granny, in as much as she too was familiar with Alzheimer's and dementia, and gave different avenues in which granny wasn't as guarded with her coming to check on her, but really she was the caregiver to check on her. So that worked out very, very well, fortunately. And granny again wasn't as just, I guess, agitated and aggressive with her being there.
Oh, that's good. That's good. Now, what type of home modifications did you have to do?
Once granny stopped driving, well, her son that passed, he actually passed in a car accident. It was her car that he wrecked and totaled, so that was the easy off on granny and driving.
Oh boy.
Yeah. So And again, so with him passing, wrecking the car, Granny no longer had a car to drive anyway. My mom was
Mhm.
able to move into the home. We then had the caregiver that would come for like 4 hours, kind of like my mom would leave in the morning. Granny was fine because she didn't wake up super duper early. Caregiver would be there for 4 hours. Granny would be home like maybe an hour till my mom got home from work. In terms of home modifications, we didn't really have to do any.
Okay.
I don't recall.
Okay.
Um, mm-mm. So Granny
Okay.
again was physically able to like do the basics, getting up, bathing, and things like that, basic grooming. Other things, we just had the caregiver and my mom to tag team on, keeping her aligned.
Okay. And then let's talk a little bit about resources or support. If you have any types of strategies or techniques as well. And I know you talked about some just tools that people can use for memory purposes for support. If you
Mm-hmm.
could just sort of share any of that in this moment to really just sort of help families.
Mm-hmm. Um, There is it like Alzheimer's.org, I believe, is the website, if I'm not mistaken. But they have lots of resources there for caregivers, right? And I just want to acknowledge caregiving is so hard because if you really truly love your loved ones, that's what you want to do. I always say it was an honor and a privilege to be able to take care of my granny in her last days. She used to always say once an adult, twice a child. And being able to have that privilege to be there for her when she was there for me when I was a child essentially meant so much to me. So I implore caregivers to reach out to those resources for themselves because you often fall to the bottom of the list in caring for that loved one. That oftentimes their needs are neglected, and they pour so much into others that they then are at an empty cup and have nothing to give for themselves or even their other family members that they care for as well. So identifying resources for around the disease to gain a better understanding of the disease is so helpful. Just so they can identify those things, especially with sundowners. Even that was an utter nightmare. I can laugh about it now, but to someone who is not knowledgeable of it can wreak havoc on their lives. And just trying to understand the whys, and especially if you don't know the tools or have the right strategy around redirecting them and how to get them through these tantrums or the rages of aggression or them trying to wander off. Please, like the internet is a great resource. And even now in this day and age of social media, I've actually found so many who are caregivers for their loved ones that post, about their journeys and such. That's really great. Just reaching out and not just like feeling like you're in this by yourself is so helpful. I just love that you have this platform to discuss this. It's largely a miss, I feel like, especially just with even the older patients that I see coming into the pharmacy by themselves, that I've even seen like, I don't think she need to be here by herself. I really recall a patient I had. I reached out to her son because she was in my drive-through in her nightgown and ran into the building. Like, ooh, why are you here by yourself? Called her son. He lived someplace else. Brushed it off. And sad but true, it happens. So just being in touch and in tune with your loved ones and recognizing as they get older, it happens. May not be Alzheimer's. It just is a natural decline in health. It happens. So just being there to help them, being there to support them, and also educating themselves around what that dynamic may look like and the sacrifices that may need to be made to care for their loved ones, to keep them safe, you
Mhm.
know.
That's good. That's good. Now, were y'all ever part of any types of support groups?
We weren't. I recognize now, especially in the last few years of Granny's life, she had a stroke along the way, which that I mean, believe it or not, up until honestly, heck, the year that Granny passed, her thing, and even years before it progressed to her being bedbound when she was still again feisty and could argue with you and the sundowners kick in and she just on a whole nother level. I could appreciate that still. And I told my mom that Granny loved old school gospel. Like when the deacons were standing in the front of church and lining him, baby, that was a Granny thing, right? So I told my mom years ago, I said, my litmus for Granny is if I play these songs, can she sing them? Because if you know Alzheimer's, you know they remember the old stuff, they don't remember the now. So for Granny, even bedbound, I would put on YouTube like Carlos and Pierce and all them old hymns, and Granny would still sing, could pick up a tune and do everything. So, even so, you hold on to what you can and just love on them as best you can, and do what you can for them. So
Mhm.
yeah.
Mm, that's awesome. I think that's all the questions I have for you. I don't know if there's any type of final words or encouragement that you can give to caregivers who feel like they're burned out emotionally, and they don't know what else to do.
Mm-hmm. I would say again, you're not in this alone. Prayer does work. God knows it does. But if you need to piggyback that with sitting on someone's couch to talk it out, please do. Because bottling up those things and holding on to them, it just leaves you in a very deprived and empty place. There are support groups available. There are resources available. Please reach out and leverage them in this journey, and just still the fact that you want to be there for your loved one is amazing. They're grateful for that, although they may not know it, how much they need it, but they truly do.
My God. This has been really good. So much great information. Thank you for helping us understand the pharmacy world,
Yes.
but then also being able to talk from the perspective as a caregiver. I'm really excited that we had you. Next week we get to bring somebody who is a nurse in the hospice space as well. And so this conversation, I think it just keeps getting better and better. And it is definitely something that is needed because so many times it's something that we just sort of keep amongst our family, or this is something that's just sort of left over to the medical community. And I feel like there's this big open space that we just really need to talk about this online on social media. And I am just grateful for the people that the Lord has connected me with. And who would have known? And now you understand why you go to some of the schools that you go with because of the connections, okay?
Yes,
That you
absolutely.
need later on because of how our paths cross.
Yes, absolutely.
Man,
I'm so grateful for you and your platform and your desire to serve the Lord in this manner and just put it out there to help someone.
yeah.
So, such a blessing.
Oh, it really is. It really is. And so, for me, once again, it was personal. My grandmother, and then sitting back watching right now with a grandmother on my father's side. And
Mm.
so, this is personal for me as well. And the Lord had gave me a mandate last year to write a book, and I went heavy in the research on this thing. And so, this is why we're here because I feel like the conversation just needs to be had.
Oh, absolutely.
And I'm
Yeah.
really big on a holistic approach as well. So
Mhm.
I'm so glad that you're here and that you came to serve the audience who came to listen and those who would catch the replay. So this has been a great conversation, and thank you for your time. And I know you need to go back and get back to work and do what you need to do. So blessings to you. Thank you so much, Dr. Narria Matthews. So glad to know you.
Thank you, honey. Likewise. Have a great day. Thank you.
All right, same to
Bye-bye.
you. Have a good day. All right. See y'all later. See me next week, okay? When I bring in a special guest who's a nurse, okay? All right, blessings.